I'm Dr. Robert McMullen.
Look towards you or the camera.
You can talk to the camera or you can talk to me, whichever one's. And this is Richard, and we've been working together about 35 years, something like that, since 1982. I just looked it up. And we were both a lot younger then.
I think I was one of your first private patients.
Yeah, I think so, yeah. And I thought we'd talk a little bit about your experience with your mood swings and your experience with the TMS. And you got your first TMS treatment 5.5 years ago in January of 2013. So what went on with your mood disorder before that?
Well, I'd get depressed, and then it'd take months, sometimes months, to get out of it. And sometimes I'd be depressed, and sometimes I'd be manic. I don't know, what was it, about 15 years ago I had ECT.
Right.
And because I was, for about 2 years, I'd become drug resistant.
Yeah.
And when I first saw you, I always said that I never wanted to have electric shock. Back then it was called electric shock. And you said fine. And then I came to you after the 2-year period because I just wasn't coming out of the depressions. And then the ECT actually worked very well.
It kind of reset you. It might have been farther back.
But then,
for the next 5 or 10 years, it was easier to control.
Yeah, and then it got worse again, and then you got the TMS machine, and I remember I was coming in every day, and it only took about a week and a half, and I was just out of the depression. And then after that, I might get depressed, and instead of waiting for weeks or a month to get out of it, to come out of it, I would have like one sort of booster shot or just one treatment, and within a day and a half, I'm out of the depression. And it's like a godsend, because before, you might be a month, you might have to do something, be working on something at work, whatever, but with this, I get depressed now, and then instead of having to wait, and I know I come in and I have the treatment, and I think it's been about 20 times in which within only once it didn't work within a day and a half, in which I was completely out of depression.
Yeah, I counted it all up. Well, actually, it wasn't hard to count up because we keep a record. But you've had 36 treatments in 5.5 years. So that averages out to 6.5 treatments per year. So like one every 2 months on average. That's pretty good.
And lately it's been less than that. I think the last treatment I had was about 4 or 5 months ago.
Yeah, it's been less common recently.
But the idea that I know that this works, and just it's amazing.
Yeah.
And no side effects.
Right.
You know,
So you don't get a headache or anything like that?
no, I come in, what is it, treatment is 38 minutes?
Something like that. Or
Yeah, and it's just there's no side effect. You sit in like a dentist chair, and there's sort of like a little cap that's put on you so they know where to put and it's just a pounding, but you hear it, but you don't. And I read magazine during the time, but no side effects.
Yeah, part of that's because we do you on the right side. Because when somebody's bipolar, if you do them stimulating one on the left, it just may cause them to cycle more. So you do a right-sided inhibitory treatment, and that's always comfortable because it's just boom, boom, just one pulse at a time. And the left-sided one, you got to go up slowly because at some point you'll cause the scalp muscles to tighten up, and then it could be sore. And actually, you would really be a bipolar too, I would guess. I would say because even though you call your highs manias, you don't get delusional, you just get really high and get activated.
Well, they were much higher many years ago. Now I hardly get the highs at all.
Yeah. And nowadays, the people who specialize in diagnostics are being more aware of the fact that there's really not a sharp line between bipolar 1 and bipolar 2. That it's really hard to differentiate in some people. It used to be that if the high was bad enough that you had to be hospitalized, then we would say, then it's bipolar 1. But it's complicated. And if somebody has a big high where they're delusional and just completely out of control, cause so much trouble they get put in the hospital, then we can say that's bipolar 1.
That happened after I can trace back my manic depression to when I was in 3rd grade, but I wasn't actually treated because I didn't really think of kids having manic depression back then. I wasn't actually treated till I was 20 years old by I saw Nathan Klein, and then he was sort of shutting down his private practice. He was taking a Rockland, doing research, and he shuttered me off to his assistant, who was terrible. And I remember after that, I think about 6 months after that, I had a high, and I was in Westchester Community Hospital for a month.
Really?
Yes. And that was the only time I was actually really, except for one time for a few days. But
so did anything set that high off? Were you taking an antidepressant?
I think no, I was taking a bunch of pills, lithium and whatever, different ones at the time, and it did set it off. And
because sometimes if you're taking an antidepressant, that will.
Oh, I was taking a cocktail.
Yeah. It's best to avoid the antidepressants as much as you can. Sometimes you can't avoid it, and eventually you have to use, if the person just persistently stays depressed, use a low dose of some antidepressant. But it's
wasn't that for the Prozac scares, that Prozac people going? Wasn't that from people being bipolar and they were given Prozac? And they had...
Yeah, it could have been. But back then, there were so many people on Prozac, if anybody did anything illegal, then they just blame it on Prozac. So
well, I was on Prozac.
If you were in the mafia, and I had a mafia guy, I don't know if I had him on Prozac or
so you said it.
But there was if it's a guy in the mafia, he
Prozac
might be
defense.
on Prozac, and then he said, well, it's because of the Prozac. So
I remember I was on Prozac and then I switched to Wellbutrin.
Yeah.
And Wellbutrin was I guess safer than.
Yeah, that's safer. Yeah, that's better. Yeah, it's too bad. There's a lot of people like you that are swinging, and it's too bad that this isn't more available to them. See, with you being my patient, you found out about it, and I could afford to do it at a low fee for you, and then we, this has really helped out. But there's many other people that are cycling like this that you could really stop. And I've had some people that we got better, but in addition, it stopped their cycling. So then, when they got depressed at some point, one I'm thinking of is because that person didn't take, usually you should stay on something like Lamictal and low-dose lithium. Lamotrigine, Lamictal, and low-dose lithium are ideal for any type of atypical depression or a little bit of bipolarity. But this person cut those medicines way down and got about half depressed as she previously was, but there was no cycling, and there'd been rapid cycling before, And I have another young lady, similar thing, where she did terrific. She was mostly depressed and a few mild highs. Patient of mine for 10 years. And she did terrific. And then when she relapsed, she just relapsed into mild depression, not cycling. And then had a few treatments and it's better. But anyway,
But the thing about the TMS is that it gives you hope. That you know, the idea that you know that you don't have to wait 2 weeks, a month, 2 months, or whatever, until you just get out of it.
Yeah.
And that, I come in and, as I said, a day and a half, I'm completely out of the depression.
Yeah.
Completely.
It's amazing. And I'm always puzzled why more people don't know about it. Well, anyway, thank you very much for...
Well, thank you for giving it to me.
Okay.